Hello guys. Welcome back to Scrubs and Studies. If you're new here, don't forget to like, share, and subscribe to stay updated with all the fun and focused medical content we drop here every week. So, today we're diving into something super important: the blood supply of long bones. Yes, that classic question that comes up in your viva tests and even MCQs. Okay, now imagine this. We're all sitting together in the hostel room, chai in one hand, notes in the other, revising for our next anatomy viva, and someone says, "Hey, what's the blood supply of long bones?" Sounds heavy? Don't worry, let's break it down just like how we'd explain it to each other before the exam: clear, quick, and easy to revise. So, bones don't just sit there. They need nutrition, oxygen, and repair mechanisms, right? And for that, they need a good blood supply. 4 main types of arteries supply a long bone. Nutrient artery. The boss. This is the biggest and most important one. Enters through something called the nutrient foramen, usually in the middle of the shaft. Once inside, it divides into ascending and descending branches and supplies the medullary cavity and inner 2/3 of the cortex. Remember, it goes into spreads inside to feeds the core. So if they ask, what supplies the shaft and medulla? This is your answer. Epiphyseal arteries. End zone heroes. These guys come from nearby joints and supply the epiphysis. But, wait, in children, before the growth plate, epiphyseal cartilage, fuses, these arteries don't meet the others. Next, metaphyseal arteries. The growth guardians. They supply the metaphysis, just below the growth plate. Fun fact, or scary, in children, infections like osteomyelitis love this area, because of the slow, twisty blood flow here. So if someone says, bone infection in kids, this is where your mind should go. 4. Periosteal arteries, the outer suppliers. These are small arteries from surrounding muscles. They enter through Volkmann's canals and supply the outer 1/3 of the cortex. So think, inner 2/3 equals nutrient artery, outer 1/3 equals periosteal arteries. Sorted. Quick memory trick. Still confused about which artery supplies what? Let's break it down into a simple chart you can write once, and it'll stick forever. So now, anytime someone asks you about the blood supply of bones, just recall this table. Nutrient deep core, epiphyseal ends, metaphyseal growing part, periosteal outside shell. Write it down once in your notes, and trust me, it'll stay in your brain like muscle memory. Direction of nutrient foramen. This always confuses people. Here's the golden line: to the elbow I go, from the knee I flee. It means, in upper limb bones like humerus, ulna, radius, the nutrient foramen points towards the elbow. And, in lower limb bones like femur, tibia, it points away from the knee. Why? Because the foramen always points toward the growing end of the bone, and that's opposite to the actual growth direction. Let's recap with examples. Bone foramen direction: growing end. Humerus down up, radius up down, femur up down, tibia down up. So, growing end is opposite to nutrient foramen. Bonus, clinical pearls. In children, metaphyseal arteries don't cross into the epiphysis because of the cartilage plate right pointing arrow, so infections like osteomyelitis can settle here. Bone injections. Often given in the metaphysis. And remember, lymphatics are absent in bones, and nerves, both sensory and sympathetic, enter at the epiphysis and periosteum. And that's it. This is how I study the blood supply of long bones. Not just mugging up, but understanding the logic behind each part. If this helped, save it for your next revision, and share it with your batchmates. See you in the next class of Scrubs and Studies.